The heart rate is like Goldilocks. It can't be too high. It can't be too low. It's got to be just right. So we know that normal heart rate is 60 to 100, but we know that in a patient with low cardiac output, the heart rate is going to try to compensate to increase the cardiac output. We know that up to a point that's actually helpful. And most of our sick heart patients, which is what we're dealing with when we talk about hemodynamics, they really can't probably go above 120 without the feeling of the heart not being able to really happen. And it's going to actually decrease the cardiac output and cause other issues. So if you see a patient that has a increased heart rate, the first thing you need to think is there something I can fix about this? So if their heart rate's 130 and they are febrile, can I treat the fever? If their heart rate's in the 130s and you know that it's due to low volume, they're hypovolemic, can you replace the volume? If your patient is having pain, can you address the pain? So those are some non-cardiac things you can do to address a high heart rate. If your patient is having an emergency tachyarrhythmia, such as VTAC, we'll be doing meds like lidocaine and amiodarone. If the patient's unstable, we'll do things like cardioversion or defibrillation. If they're having a more stable tachyarrhythmia, such as SVT or AFib-RVR, we'll do things like beta blockers and calcium channel blockers. You may also see adenosine used or cardioversion if those things aren't helpful. If your patient is having a bradyarrhythmia, things like epinephrine, atropine, dopamine may be used. If your patient is unresponsive to medications, you may have to try pacing, transcutaneous, and if that doesn't work, maybe even transvenous. The important thing is if your patient is having a heart rate that's impacting their cardiac output, you have to intervene to fix that. Knowing how to treat heart rate to optimize cardiac output is super important. To continue to follow the series on hemodynamics, like this video and follow this page.